Hello, everyone. So my pleasure to welcome everyone today for this wonderful EPIC seminar on cognitive health and dementia. We just let everyone connecting for just a few seconds, and then we will start the presentation. So people are currently creating, so that's great. So I will share my screen for the first introduction and giving the time for that, just few reminders. This EPIC conference took place from Tuesday to Friday this week, and we will continue on Zoom at noon time, Eastern time next week up to Thursday. So we encourage everyone to participate to all the session as much as possible. So for today's session, we will have two research presentations, and after each, we will have a 5-minute Q&A session. And then we will have a moving the dial presentation. And after all, we will have a general Q&A session. So just feel free to ask your question and to contribute. It's just a wonderful opportunity to have capacity to discuss with everyone about this work and this general challenge. So feel free to ask your question in the Q&A box, and we will then contribute and give them at the end of the session. So I will just start with a short presentation about this challenge we have to consider today, which is cognitive health and dementia. Just a few words to present myself. I'm Dr. Tannou. I'm geriatrician and early career researcher at the Institut Universitaire de Gériatrie de Montréal. So I'm also a research assistant at the University of Montréal. And I have a specific research topic about self-perception disorder. I consider the question of what we call in medicine anosognosia. And so this type of disorders that came during cognitive impairment and impact your capacity to perceive yourself with your disease, and how it can reduce your capacity to accept social services and medication. And so if you consider that everything is going well, you lack anticipation. And so at the moment we can introduce some procedures and some approaches to reduce the impact of the disease. If you refuse it, you then go directly through the side effect of the cognitive disease and the need for relocalization very often. So it's my topic of research, and I try to consider how technology can be supportive to help people to improve their awareness of their self. Why it is important to consider the question of cognitive health and dementia during aging is, and you know these numbers, it's because of the increasing number of people aging and over 65 years old in Canada and worldwide. And cognitive impairment is directly associated with aging, so there is a need to consider it. When we talk about cognitive impairment, I want to share with you that I want to make it clear as a physician. We consider cognitive impairment as what we call cognitive dysfunction, which is difficulties for naming, for language, for calculating, for planification, for memory, which is encoding new information. But this dysfunction has to be evaluated through standardized test-based. I mean, it's not the fact that you feel your brain is not working well. We consider it as a subjective cognitive dysfunction, but not what we call here cognitive impairment and dementia. So we have standardized test-based, and we have to show a slow evolution of the process. If you are not good at recognizing people and faces, but you were never good at it, it's not a sign of cognitive dysfunction. It also has to be considered in relation to your age, your sex, and your level of education. And finally, this has to impact your daily living activities. When there is no impact on it, we talk about mild cognitive impairment. And when you have impact on your daily living activities, we talked about major cognitive impairment, sometimes named as dementia. We know a good example of this process through the biological and clinical evolution of Alzheimer's disease. And I want to share this with you because, in fact, when we talk about cognitive impairment and dementia, we talked only about the end of a long-term process, which is a biological process starting grossly 10 years before the beginning of the disease. And we have to consider a lot of prevention, primary prevention before any biological modification, secondary prevention when we have first sign of biological modification but no clinical impact, and then tertiary prevention when we have the first clinical impact and we want to reduce the daily living activities consequences, and then the symptomatic and palliative care to take care of the patient all along the continuum. We, of course, have a lot of medical perspective, and as a physician, I'm happy to share that there is new potential and opportunities that may at some point give the opportunity to have treatment. However, this kind of treatment, if they go through the market, will only concern a few parts of patients living with any kind of cognitive impairment. So we cannot completely rely on this future perspective. It's great, I mean, but it's not how we can consider accompanying the majority of older adults living with any kind of cognitive difficulties. And so the major vision of how to reduce the impact of cognitive impairment is to focus on prevention all along the life and health promotion. We want to consider the fact that, and now we have proof all along the literature to see that all along the life we can consider reducing the activities that impact the cognition. And even when you start having a cognitive impairment, the finger model developed in Northern Europe show how we can modulate and reduce the evolution of the cognitive impairment with mental stimulation, with social activities, with physical activities, with health, general health control. So to achieve this goal, we need physical activity, nutrition, social participation, and all are stick together to support aging. However, there is a lot of barriers, and notably the accessibility, the burden of caregivers, the knowledges, the lack of time, the social isolation, and so on. And so to support this, AGE-Tech can be an opportunity to promote cognitive health and active lifestyle, to delay the onset of the cognitive decline, and to provide early diagnosis, to make sure to plan adequately for the future, and to provide assistance to all people already experiencing some level of impairment to support them to maintain their current life. And so for that, there is a lot of AGE-WELL project. You have here the vision of the AGE-WELL project in the general field of cognition, health, and dementia. But there is also, in fact, a lot of opportunities in the ecosystem of AGE-Tech, sorry. And we will have the opportunity to see some example during today's session. So that was what I wanted to share with you before starting the session. It's my pleasure to introduce the first presentation given by Lily Wren and Christine Wallsworth. So Lily is a PhD student in interdisciplinary studies at the University of British Columbia. She is supervised by Dr. Lilian Hung at the School of Nursing and co-supervised by Dr. Ben Mortensen in occupational science and occupational therapy. She is a research project manager at UBC's Innovation in Dementia and Aging Lab, funded by Dr. Lilian Hung. She currently leads project on a co-creation virtual reality program in hospital for older adults with dementia and an AI-enabled robot for long-term care home. Lily is interested in ethical consideration in technology implementation for dementia care delivery in hospital settings. And Christine has been involved in healthcare systems since more than 10 years as patient and family partners with both VCAs and UBC and Providence through both the Patient Voices Network and Community Engagement Advisory Committee. Christine joins this volunteers opportunity to give a voice to patients and families within the BC healthcare system. She was a care partner to her late husband, who over the last 21 years of his life has considerable interactions with various health-related professionals, hospitals, and agencies. Christine took on an advocate role on his behalf as his cognitive abilities deteriorated through both Alzheimer's and later Lewy body dementia. Christine is passionate about patients having their voice heard, as well as being able to affect change within the healthcare system. So you will share your presentation and we're just here for you. Thank you.
Thank you so much, Thomas, for the wonderful introduction. And I love your presentation too. Yes, so hi everyone, I'm Lily. Together with Christine, we are very excited to share with you about co-creating virtual reality programs with patient partners, family partners, and staff for older adults with dementia in hospital setting. So we are very excited to see our principal investigator, Dr. Lilian Hang, is here supporting us. Also, our collaborators, our team, like patient partner, Dr. Jin Lan, thank you for just being here to support us. And you can see we have a wonderful team. We have co-investigators, Dr. Angela Lim and Dr. Ben Mortensen from diverse disciplinaries and collaborators. We have Dr. Jen Borger and our clinicians. We also want to acknowledge our wonderful trainees. We're all from different fields, different experiences, and we are just all passionate being here together to work towards the same goal. And Christine, would you like just to say hi to everyone, introduce yourself?
Sure. I'm Christine Wallsworth, and like Lily said, I'm actually a family partner with the Idea Lab at UBC and currently partnering on the Co-Create VR team project. And I would like to say that we are a multidisciplinary and multi-generational team that includes not only seasoned researchers and clinicians, but also junior researchers, grad students, and people with lived and living experience of dementia.
Thank you so much, Christine. It's my honor to co-present with you on behalf of the team. So, Christine, how about you introduce our background to the world? Yeah.
Sure. So, virtual reality, to introduce this topic, you have to consider the hospital environment that dementia patients often find themselves. They tend to be isolated either physically, which is a separate ward, and usually, but not always a locked ward, or emotionally, so they're unable to communicate their needs. So bringing VR into the hospital setting opens up new avenues for patients to engage in an activity that has meaning to them and to be part of their community. However, older adults with dementia are frequently excluded from VR opportunities for various reasons. It can range from resources, which is equipment in the hospital, or staff, as well as a bias that may exist within the hospital setting itself. So by engaging all of the stakeholders in co-creating a VR program, we believe that this will help achieve the best possible outcomes for people, older adults with dementia in hospital settings. So co-create begins with the unique needs of the older adults with dementia, but everybody within the program itself, like who are part of the co-create program, has a voice that they bring to the program. All partners are listened to, and the program is adjusted where feasible to accommodate as well as support a fulsome partnership. When we did our LIP review, we actually found that there were very few partnerships that are as unique as we are.
Thank you, Christine. Nice introduction. So our study objectives here is to understand and address the psychosocial needs of older adults with dementia in hospitals by using virtual reality programs. And by the way, I would like to highlight that all pictures here you see is taken really during our technical trials to our diverse partners and also during our data collection. Yes. So our study method is we use collaborative action research. We want to focus on equity and inclusivity when working with our partners. We conducted a series of qualitative focus groups, co-design workshops, and one-to-one interviews with 46 participants. So who are they? We have 7 patient partners, 8 family caregivers, 19 staff members, and also 12 leaders from a hospital. So what guided our data analysis is a consolidated framework for implementation research, or CFR. So yeah, Christine will share with you some key findings. So we first of all find the 3 themes to co-create VR for older adults in hospital to address their psychosocial needs and facilitate staff's implementation. So the acronym is AIM. So the A stands for the approach matters. So what do we mean by that is we really uplift the personhood and be gentle and be inviting. That, hey, Mr. Joe, we know you like cats and we have some cats videos for you. Would you like to have a trial? So yeah, so just really speak to their maybe past memories and experiences. And also we heard a lot from our partners saying that maybe suggest to watch the videos with purpose instead of, just stay there and watch. So we can be interactive during this process. Like, do you see elephants? For example, if we are watching a video in zoo, and how many elephants do you see? How many big and how many baby elephants do you see? So we want to make people engage in watching the videos. And yeah, Christy, would you like to share about multisensory stimulation?
Yes, I would. For the multisensory stimulation, the team worked out of the Idea Lab to bring together the video, music, and aromatherapy. So with the use of aromatherapy, I find very exciting because we had like a sense of BC aromatherapy, and we had an enjoying nature video, as well as soothing music. And we have the coffee cup there because we actually did have a scent of coffee, and it really did smell like coffee. So we are going to pair it up with like a cafe scene and of course appropriate music. So I find this fascinating, and also we can tailor it to what the patient actually needs. There has been a request for knitting, to see somebody knitting, and as a knitter I actually took on this project, so I'm actually in the throes of knitting a baby blanket right now. So that again will add to the multisensory, because the finished product could actually be passed around so that people can feel the wall And I'm actually knitting a pattern that has actually a pattern in it, and they can feel the different textures within the wool. So this is, I find, very exciting, and it provides an extra stimulation to the patient.
That's wonderful, Christine. And yes, so our conclusions here. So we basically found that older adults with dementia in hospital settings, they totally deserve digital equity. But however, they're traditionally underrepresented in technology development and implementation. So that's why we find it is really important to engage patients, family partners, and staff to co-create VR programs and to address their psychosocial needs, like diverse needs.
Yes, and I would just add that everybody deserves to be respected as a person and to be treated equally, regardless of their cognitive abilities. So when we create a VR program as a cohesive team, we can also boost the patient's sense of self by engaging them in a meaningful way. And this is very important, is the engagement in a meaningful way.
Yes, thank you. And would you like to have any add-on, or if you're good here, Christine?
I don't think so.
Okay, yeah, great. And
So
yeah, you go ahead.
So we'd like to thank the agencies that are listed, and also the universities on the site, because without their continued support of our work, we would not be able to do it.
Yes, we acknowledge our funding agencies for the support. And I just want to say, please do not forget to follow us on social media and also scan the QR code to know more about our study. Thank you so much, everyone. And now we look forward to your questions.
Thanks a lot, and congratulations for your wonderful presentation. It's so interesting. And you can see also on the chat that there is some commentaries on the intergenerational approach, and congratulations for that. We have one question first by Sivim, which is, what skills do you need to create or co-create VR programs for caregivers and our caregivers and patients with dementia?
Christine, would you like to go first?
Sure, you actually don't need any specific skills to co-create videos. We actually use GoPro, which I actually researched and recommended that we use it. It's quite an easy app to use, and it's basically like the name suggests, you pick it up and go, you know, and it's been highly successful.
Yeah, and my quick add-on is that instead of skills, I would say it's more like it's retrospective. So it's researchers' responsibility to make it an inviting and welcoming space for our partners to join, and we feel a safe environment to share what you think the needs is really for the community you're on behalf of. So that's why we do a lot of calls together. And like the co-present you see with Christine here, and also we co-develop knowledge translation materials together. So with all these efforts, that builds trust, and so our partners are more confident to speak out more in some future like focus groups or event opportunities.
Yeah, I would add that we actually do meet. We meet once a week, and this is beneficial. We really come together as a group. It's really, really good. It's exciting to be in the meeting every week.
Thank you. That's very well said, Christine. Yes.
That's really great, and I just want to thank you again for your wonderful presentation and stimulating project. It's very exciting. Thank you for that. There is other few questions in the Q&A chat box, but I think you can easily try to answer by chat during the meantime. So it's now my pleasure to introduce you to the second presentation, which will be made by Sabah Rashid and Ashley Cole. So Sabah is a PhD student specializing in organizational behaviors and human resources management at Wilfrid Laurier University. Her research interests include personal selection, psychometric assessment, and diversity and inclusion in workplace. Her research has largely focused on assessing the validity of psychometric assessment while balancing diversity and inclusion. She is also actively exploring applicant faking on psychometric measures, sources of interviewers' bias, and sexual harassment in the workplace. More broadly, she is interested in bridging the research practice gap by addressing practical issues in the field and disseminating key insights to the relevant stakeholders, including organization, applicant, and employees. Ashley is a PhD candidate in industrial organizational psychology at the University of Guelph. Her research expertise focuses on workplace behaviors with an interest in topics ranging from workplace incivility to organizational pro-environmental behaviors. Currently, our research center around employers' endorsement of employee voice. She is passionate about conducting high-impact research and mobilizing knowledges a patient ignited through her work at the Community Engaged Scholarship Institute. She is enthusiastic about continuing his passion at CogWork, where she examines technologies for accommodating cognitive impairment in the workspace. So it's your turn to present.
Thank you for that lovely introduction, Thomas. Today we'll be presenting some of the research that Ashley and I have been working on with the CogWork research team. So this includes all of the folks listed here and without whom this research would not be possible. Specifically, the project we'll be discussing today investigated the role of technology in supporting employees with mild cognitive impairment and dementia. As can be seen in this chart, labor trends have shown that Canadians aged 55 to 64 years old are working longer. In 1996, if you take a look at the chart there, 47% were working and in 2016, compared to that, 66% of this age group were working. Many are not retiring at 65. As of 2015, 1/5 of Canadians who were 65 years or older were still working. In fact, many retired Canadians seem to be working part-time or are self-employed. So given the increasing population rates of older adults within the workplace, employers might be presented with new challenges like accommodating the needs of employees with progressive impairments. This includes mild cognitive impairments and young onset dementia. So as stated here, the rate of young onset dementia in people 30 to 64 years old in Canada is about 3%. And the prevalence of MCI ranges from 13.4% to 42% in people aged 65 and older. Before we jump into our work specifically, it may be useful to define what exactly we mean when we use terms like YOD and MCI throughout the rest of the presentation. So young onset dementia, or YOD, refers to dementia that occurs prior to the age of 65 years old. Mild cognitive impairment, on the other hand, refers to the state between normal cognition and dementia, which involves a decline in cognitive abilities, including memory. So young onset dementia refers to when symptoms began, while MCI refers to the severity or degree of impairment. Given the state of the labor trends we went over earlier and the prevalence of MCI and young onset dementia, we developed 3 research questions. However, for today, we're only going to be focusing on the third one. What technologies are, have been, or are planned to be used, or are needed by employers to predict, analyze, or accommodate workplace aging and MCI and YOD? To put this in simpler terms, we wanted to know what technologies can employers use to support their employees. So let's take a quick look at what we did. First, we recruited 96 participants across two large Canadian organizations in the healthcare and government sectors and asked them to participate in a short survey and a 1 hour long semi-structured interview. To analyze our qualitative and interview data, we started by building a coding manual based on existing theory, but we'll tell you more about that in just a moment. As you can see across the two organizations, they were quite similar in terms of their demographic makeup. This included age, sex, education, and ethnicity. And on the right side, you can see that while employees generally held positive attitudes towards those with MCI and YOD, there appears to be a gap, and to varying degrees within the organizations, of course, but there appears to be a gap regarding policies in place to support employees who develop MCI and YOD. So as mentioned before, we grounded our analyses within existing theory. And one of these theories was the socio-technical systems model. The theory suggests that the best outcomes are achieved when the social and technical elements of an organization are aligned and are designed in such a way that they complement each other. This means when trying to answer our third research question around the technologies that are needed to best accommodate employees with MCI and YOD, we need to consider not only the technical elements of the organization, including procedures and the technologies that are used, but also the social elements of the organization. And this includes the employees and their interactions with each other, as well as their interactions with organizational structures. I'll now pass it off to Ashley, who's going to walk us through some of our findings.
Thanks, Saba. So our findings highlighted several organizational barriers within the social system that exists to accommodating employees with MCI and YOD. Formal processes for accommodations may be lengthy and inflexible, meaning that for employees with MCI and YOD, they may experience barriers in accessing timely and appropriate support. And given the stigma that exists around MCI and YOD, employees may feel scared to seek out formal accommodations from their employers. For example, one participant shared there's barriers because of the policies they have in place with the doctor's notes. But in my experience,
your screen, if you just don't mind to have your screen back. Yes, thank you. Sorry.
Perfect. Sorry about that.
And then they shared, but in my experience within my division, it's been very accommodating. So given the lack of awareness and education that also often exists within organizations regarding MCI and YOD, employers may be unable to identify appropriate supports. And the progressive nature of MCI and YOD means that accommodation needs may change over time, requiring managers to stay updated on employees' functional limitations and accommodations, including supporting employees' learning of new technologies. However, this can be challenging for managers to prioritize with their other workplace demands. Participants also expressed several technical barriers and facilitators within their organization to accommodating employees with MCI and YOD. For example, work environments that prioritize rigid adherence to tasks and performance metrics over flexibility could create cognitive overload for employees. Flexibility, such as adjustments in work schedules, task management, and performance evaluations, were really imperative to employees with MCI and YOD, given that symptoms can also vary among individuals. One participant shared giving the worker a new job that they agreed upon or that was still within their skill set, but also giving them the tools and the hardware or software to do the job. There was voice recognition brought in for one worker. There was multiple sit-stand desk orders, multiple different chairs. I didn't understand how many different chairs were out there. This quote highlights an extensive list of modifications that really challenges a one-size-fits-all approach by introducing some flexibility to cater modifications to meet one's needs. However, what we also sometimes saw was that a lot of current technologies offered were suboptimal. Windows accessibility tools such as Zoom, magnifying glass, and voice-to-text services, for example, we're not always able to meet the complex and specific needs of employees with cognitive impairments, as these tools cannot always provide support for memory, task management, and concentration. And so to end off the presentation, we thought we'd leave you with some potential solutions that could address some of the barriers we have discussed, such as offering continuous training and education for employees with MCI or YOD to adjust to the new role or changes with their condition, and for managers to develop an understanding and awareness of MCI and YOD, as well as offering flexible work hours or the possibility to work from home to accommodate fluctuating cognitive capabilities, as well as the identification of roles that might accommodate fluctuating cognitive capacities. We also propose designing workspaces that are easy to navigate and free from unnecessary distractions that can help in reducing cognitive overload. And lastly, we propose implementing adaptive technology that can assist in compensating for the progressive nature of cognitive impairments, such as AI and smart technologies. Thank you. We look forward to hearing your questions.
Thank you for your very great presentation, and it's very stimulating. I think you highlight an issue that, just to be honest, as a physician, I'm not enough trained of, which is a question about the impact of cognitive impairment in daily ward and daily professional activities. So it's a very, very important topic, and thank you for that, because we very often associate cognitive impairment and dementia as disease for older adults, and so we exclude from that issues relative to work and work adaptation. So it's a very specific and very important topic. I just want to thank you for that. We currently don't have so many questions in the Q&A question, but maybe during the time for that, I have one for you concerning the innovation you propose in terms of education, because it's tricky how to manage the way to have education and cognitive impairment without providing risk of discrimination when you focus on people having cognitive difficulties. And how do you think we can integrate this philosophy of cognitive dysfunction within workplaces?
Yeah, no, and that's been one of the challenges we've been sort of probing through the interview data as well. I think one of the things that came up a lot was that, like in terms of training, I think what we're referring to is offering employees and perhaps management as well some rules of thumb of things that might help recognize first signs of cognitive impairment or dementia as they begin to form in the workplace. Because what often starts to happen is, associated with the nature of the disease as well, is like there may not be self-awareness. And so like the people around you tend to notice the first signs first. So providing that training for what that looks like in the workplace might be beneficial in that regard. Additionally, it might help to build draw on their expertise as well, to sort of like give them, like this is what MCI and dementia look like, and how can we collaborate with you to come up with appropriate accommodations that would fit and flexibly fit the employee over time as the disease progresses. Given like employee shortages as well, it seems like that is something that employers are more and more inclined to, approach and attempt to do.
Thank you. We have a question also about what are the main barriers for the employer to implement some solution? Could government policy support changes and force employers to accommodate MCI needs?
Yeah, we did see that middle managers, especially, this kind of fell on them, especially when we're looking at large organizations. They were often closest to working with employees, but a lot of times they often lacked the power to implement significant changes. And so, or the resources to to appropriately support employees. Because also these organizations are government funded, we did see also legislation as well as even just like public perception of these organizations also influence how folks went about supporting employees as well. So for managers, we're hoping, I see another question about also just like pulling this research together. We are hoping to do some like knowledge translation pieces, especially for employers on how we kind of can balance both the resources and demands they experience.
Thanks a lot for your comments and answers. There is still a few Q&A questions in the chat and in the Q&A session, and we will have a general Q&A discussion for at the end of the next presentation. But now it's time to have the presentation. The Move the Dial presenter is Brian Hong of EPIC-AT. As we age, we lose the specific details that make up memory for life events. This process is exacerbated with dementia. Memory loss can have profound consequences on one's self-identity, independence, and social relationship, which can in turn worsen memory loss. To address this, Brian and his team developed EPIC-AT, an easy-to-use and validated smartphone-based platform designed to mimic the function of the hippocampus, a brain region that is essential for supporting memory. Specifically, EPIC-AT guides users to create and review cues using principles from cognitive neurosciences and psychology. Research found that EPIC-AT produced long-lasting memory benefits with enhanced activity in the hippocampus, demonstrating the potential for a simple and scalable solution that helps individuals preserve memories for the moments that matters most to them. Brian, your turn.
Oh, sorry about that. Let me just quickly share my screen. Thanks for that lovely introduction, Thomas, and it was great to hear everyone's presentations and see the lively discussion in the chat. Sorry about that. Cool. Does that look good to everyone?
Yes.
It does. Okay, great. Well, thanks everyone for coming out and hearing about the presentation. I'm excited to share about some of the work that we've been doing with EPIC-AT. My name is Brian Hong. I'm a postdoc working at the University of Toronto in the Department of Psychology, and I've also been helping to work on this project since the start of my graduate career in around like 2016. So let's get started. I just wanted to go over the general problem here. So as we age, there's this tendency to forget these details of events that make each of our experiences that we have in our life unique. So for example, on a trip with one's grandson to the park, there's likely going to be a lot of like these specific details that this person is going to want to remember. So maybe how he was inventing a fun game with the digger that he's using, or how he saw his first ice cream truck and had a nice ice cream cone. However, what tends to happen with age is that these specific event details that make these events special tend to get lost. And it's these kind of events that, or details, that can have a huge impact on one's sense of well-being and confidence. And this loss of details can leave people feeling disconnected from these events from their life, which can in turn further exacerbate this memory loss. Now, this is a huge concern for many individuals, with over 1/3 of retired individuals reporting this dementia as one of their greatest fears. 1 in 10 individuals over the age of 65 are currently living with dementia, and this has a huge societal cost on the healthcare systems combined at $300 billion annually. So there's this urgent need for these scalable interventions to help stave off this memory loss before dementia can occur. So what we wanted to do here was draw on our knowledge as memory scientists and focus on what are the brain structures that are involved in supporting this type of memory. So specifically, what we wanted to focus on was the structure called the hippocampus. So what we're looking at here are just two graphs here showing declines in the hippocampus with age. So as you age, your hippocampal volume tends to decrease, and this tends to be linked to decreases in this loss in this unique elements of these different events, otherwise known as episodic memory. So one thing that might actually be happening is that the patterns in which we're representing these events in the hippocampus might start to blend together. So say, for example, you have these two events with your grandson. They're encoded by two different patterns of activity in the hippocampus, but with age, what might tend to happen is that these patterns of activity tend to blend together, and it becomes harder as a result to pull out these unique details for each of those. So they start to overlap with one another. So what we set out to create was this smartphone tool that we wanted to create that helps to mimic the function of the hippocampus and how it supports and scaffolds the consolidation of recent memories. So that's what we've been working with on over the last 8 years, and this is led by my supervisor, Dr. Morgan Behrens. Okay, so what is Hippocamera? On the surface, it looks relatively simple. There's only two main key functions here. So first, it guides users to really pay attention to the events of their lives and then record these extremely rich autobiographical memory cues. Later on, the app then prompts you to study back these cues using the strategies that we know from memory science to help promote long-term memory. So let's say that there's an event happening that the user wishes to remember. What they would do is click that record memory button at the top over there. They would then record the short 24-second video snippet. And then afterwards, they would record a little verbal description about what makes that particular event unique. In the background, Hippocamera then combines these to make this compact and distinctive cue that has this 24-second video with that audio tag overlaid. So the idea here is that it guides you through this recording process that makes that memory encoding intentional. So it stops you and forces you to really focus on that event on your life. And because that memory is intentional, it's going to help promote later memory as well. Later on, we replay these memory cues using principles from memory science, unknown to help optimize memory. So I'll just present one of these short little cues that I created over here. Let's see if this video works.
Watching the total solar eclipse at Bayfront Park in Hamilton.
Okay, so I'll just show you one of those. That was one that I created when there was the eclipse there. And the idea there is that you watch 5 of these in succession, and then you're able to notice what those associations are between them. So the idea here is that you're able to distribute your learning over time. You're able to see the timestamp that's occurring between them, and you create these associations between these events that make up your life. So the idea here is that we have these memory strategies, and then we're able to study these back. Now, we wanted to really make sure that taking these principles from memory science and creating this tool would help actually produce memory benefits. And what we found is that there are robust and long-lasting memory gains. So when we bring people to the lab and ask them to retell these memories that they had recalled with Hippocamera, these Hippocamera events have been recalled with over 50% more details and event-specific details. And this was evident even after 3 months after they had stopped using the app. We also used neuroimaging and showed that Hippocamera enhanced the activity in this hippocampal brain network, so that same structure that helps to support this encoding and consolidation of memories. And then, as we touched upon before, it's not just like the memories themselves. Participants are actually recalling these events with more positive emotion as well. And we know there's a strong link between emotion and memory. We're also doing some preliminary follow-ups where we're bringing back these individuals from these studies several years later, and we find that there's evidence that these benefits may persist even like 3.5 to 5, 6 years after they had stopped using the app, suggesting that just like the long-lasting nature of these memory benefits. And this is work led by an RA in the lab, Eliza McCain. Now, a common issue for many interventions that are based in the lab is just low uptake and adherence outside of a research setting. So what we've been doing is working with older adults to really improve the usability and acceptability of HIPIC camera. So as many people have touched upon throughout today's session, the importance of this co-design and taking this person-based approach. So we're doing a lot of user interviews and working with older adults and caregivers to help really improve that usability of HIPIC camera. So just to give like a little snippet of some of the work that we've been doing, we've been working with the LEAP community at Baycrest here in Toronto, which is this advisory panel of older adults and caregivers. And they've really given us this wealth of information to help inform future directions that we can take. So they've mentioned things like building in reminders or suggestions for events to record in their day-to-day life, talking about things like educational modules for modifiable lifestyle factors that Thomas had touched upon at the top of today, and also this importance of being able to share these memories with their loved ones and family and friends. And then Raphael Kwok here is another research assistant in the lab who's also conducting work to help ensure that older adults are able to learn how to use this tool independently and integrate it into their daily life. So rather than come into the lab for this lab-based session with a researcher, they can use it and pick it up and just use it by themselves. Of course, it's not just me involved in this work. It's this huge collective effort from an incredible team of scientists led by supervisor, Dr. Morgan Brens, and also all these folks here who helped contribute to the work that I had talked about in today's presentation. And I also want to thank all the funding agencies that also helped make this work possible. All the older adult participants and caregivers who had helped contribute to this work, and everyone here today for listening to the presentation as well. And I'm excited to hear any questions that you might have.
Thank you so much, Brian, and congratulations for your presentation and for this incredible idea you had. It's just fascinating. We have a really fascinating presentation today, sorry. So we have a few questions for you and then question for the general panel. So maybe one question for you, Brian, is what if the user feels like it's just too late to capture this memory? Because, you know, sometimes we just feel that it's now, and so how can we manage it?
Yeah, that's a really great question. So I guess like with any kind of like skill or kind of like tool that you're going to be using, it helps to just get into the habit of doing so. So the idea here is that especially initially, sometimes people have difficulty identifying like which events that they wish to remember. But over the course of usage, we've actually gotten really cool feedback that it's not just like the memories themselves, but it's helping them to change kind of their lifestyle factors as well. So we've gotten feedback saying that people have been really eager to kind of like identify like what is that one special moment that I want to remember each day. So it really gives them this more like positive mindset on the events that they're taking part in their life. They're also saying things like, oh, it's been really cool to actually I've been taking new routes and going to new things just to kind of explore new things and create these new memories. So touching upon some of like those lifestyle factors that people have been mentioning as well. So again, it's just kind of like this habit, but we're kind of building in like these reminder systems and kind of things like this to help people capture these cues at the time that they're happening. And of course, you can record them later on, and it'll also help you memorize that as well. So for example, like we had someone talking about like this wedding that they went to, but they had forgot to record it at the wedding, but they recorded, say, like the party favors that they got from the wedding afterwards as a reminder for what that event is. So people come up with these strategies to help them remember these different events that they're experiencing. But yeah, that's a great question.
Finally, strategies are also part of the process of remembering, which is great. You know, Brian, and all that AGE-WELL is also an opportunity to support age tech ecosystem. So just do you mind in few words to talk a bit about the commercial timing and how you manage to go from your idea to a commercial product?
Yeah, for sure. So I'm a postdoc by training. So like I started off as graduate school. I didn't really know like where this project would take us. I was really kind of interested in seeing whether we could translate some of the research that we had known from memory science, from say like best remembering like items on like a word list or say like objects, to these real world events that we experience on a day-to-day basis. And in doing so, it kind of led us on this path in creating this tool that might have this long-lasting and meaningful impact on people's lives. So we've been gracious in the U of T community to have support from these accelerators and incubators that help researchers like myself to understand kind of like the pathway to commercialization. So we worked with the U-Test at University of Toronto, so University of Toronto early stage technology. And also a lot of like the training at AGE-WELL has helped us to kind of like create this tool that's more on a commercial pathway as well. But we have an early access version that's available for anyone to use right now. So if you download it, you can kind of, it's early, but you can of course take a peek at it and try for yourself as well.
Great, thank you very much for sharing. Thank you everyone, because we had so wonderful presentation today. In order to close it, one word for each of you. What's your motivation for being involved in this kind of research? Can you just describe it in one word for each? And maybe in the order of my screen, you can Ashley start.
I'll use, I guess, 3 words. It's just like high community impact. So.
Thank you, that's fair. Kristen?
So I can't use one word, so I'll just say that for me, it's actually about empowering people to actually be the best that they can be at the stages they're at.
Wonderful. So community, empowering. Lily?
Yeah, I would say leaving no one behind, and it just yeah, uplift everyone. Thank you.
Wonderful. Saba?
Again, it's really hard to do it in one word, but I think for me, it's about practical solutions a little bit as well.
Yeah, I guess I can go as well. I'm going to take a cheat answer and kind of combine everyone's, but like, you know, creating these like practical solutions that really produce this long-lasting impact, no matter where you are on the aging process. Yeah, it's been really inspirational to just work with all the older adults and caregivers on projects like these, and just hear kind of like the feedback and impact that it can have.
Very inspiring today's discussion. I just want to share to you that it was a complete privilege for me to share this session, and I want to thank everyone. We have 1 minute less for any question or comment if anyone wants. Otherwise, I just want to remember you that the AGE-WELL EPIC conference continue next week. And so our pleasure to meet you next week for the next challenges presentation.